You on a medication known as HCTZ or Chlorthalidone. These are what we know as water pills or diuretics. Now, you might also be on or know a family member that's on something called Lasix or Furosemide. This is also a water pill or a medication called Spironolactone, also considered a water pill. Now, these are just three of the diuretics that we use in therapy, but they are all used for very different reasons, although there are some overlaps. But patients will often walk in and ask me, if I'm on this water pill, why do I also need to be on this other water pill? And the reason is very simple. These two water pills are very different. So you're not looking at apples to apples, you're really looking at apples to oranges. And it's not it really isn't a crazy question because if you're someone who really pays attention to your medications, you might be thinking to yourself, why am I on two medications that are meant to be water pills? And so these types of questions or these types of moments really remind me how many people are taking medication without really being told, how to understand these medications and what they're actually doing. So the thing to think about with these diuretics is that one of them barely pulls water off your body at all, even though it is still considered a water pill. One of them is strong enough to pull a liter or more of fluid off of your body in just a single day. One of them protects your heart, specifically in heart failure, and actually has been shown to improve survival or prolong survival in patients with heart failure. And one of them can make your potassium levels high, while others may drop your potassium levels a little bit. So let me ask you this. Has anyone ever explained to you why you were put on your water pill and how it is actually working inside your body, specifically working on your kidneys? Most people say no to that, at least to part of that question. So I want you to stay with me to the end of this video because not only am I going to talk about the diuretics, specifically the three classes of diuretics, but also I'm going to reveal one thing that I think everyone should know about diuretics that I don't think a lot of people know or understand, including some healthcare professionals. And it can really change the safety and the safety profile of the medication and the way that you use it. If you are new here, my name is Dr. Takova Wallace-Gay. I am a clinical primary care pharmacist. I'm also an educator of medical and pharmacy students and creator of the Bridge to Better Meds platform. Now, I am not a pill pusher, although I am a pharmacist and very passionate about it. But if you do need medication, I want to make sure that you are using it safely and confidently. So here on my channel, I break down medications in plain language so that you can feel confident, more protected, and really more in control of your health, specifically when it comes to the medications that you're taking. And finally, before we dive in, if you haven't already, please download your free medication mind map guide using the link in the description. I'm using something called Learning Science, and Learning Science tells us that when you see information, categorize it and write it down, you remember it more clearly. And my med map guide helps you organize your meds specifically in that way. You can see what you take, what it's for, how it works, what things to watch out for, what are some questions that you should ask your providers, and all of that is going to be laid out in one simple framework, all on one page. So, again, click the link in the description box below to grab that. Now, let's jump into these medications. So, I'm going to start with my ABCDE framework. And A is action. So, starting off, what do diuretics actually do? What's going on with the kidney? And what the heck is a nephron? Because that is really where these medications start. So, people will hear the term water pill and assume that, all of these medications work the same. But each of these diuretics is going to work in a completely different part of the nephron. And that is why they behave so differently. So, let's start off with what is the nephron? You have two kidneys. Most people have two kidneys, and each kidney has about 1 million nephrons. These nephrons are just tiny filtering units that really help keep us alive. They filter things out of our blood, and we reabsorb back into our blood some things, and some things stay in the nephron and are excreted or eliminated in our urine. So they filter out things, put some stuff back in the blood, other things out through the urine. And again, there are millions of these in each between each of your kidneys. So if you think about a nephron as like kind of a long hallway, and it's kind of shaped like this. I'll put a picture on the screen. I usually will tell people that it's like a long hallway with a bunch of different doors. And so the different medications work on or enter into different doors or different rooms. So there's a sodium room, there's a potassium room, there's a room that's specifically focused on balancing water, there's a room that's focused on the acid and base component balance. And again, all of these medications are going to work differently depending on which room they walk into on this nephron. So we're going to start with the thiazide diuretics. Some of the most common examples of thiazide diuretics are hydrochlorothiazide, which most people know as HCTZ, and chlorthalidone. These are very similar and used for very similar reasons. But the thiazides are kind of tricky because they enter the nephron early in what we call the proximal tubule, but they don't really work on the nephron or work in the room until later in the distal tubule or distal convoluted tubule. So here's what they do specifically. Thiazide diuretics are going to block the sodium chloride pump. This is a pump that pumps in and out sodium and chloride. So this means that if they're blocking that pump, now sodium is going to stay in the nephron instead of being reabsorbed back into the body, and it's going to go out into the urine. Now, here's something that you need to know about sodium before I move forward. Sodium is a leader. And the main thing that follows sodium is water. Water is a little shadow, it's a little follower. And so anytime we get rid of sodium, we're also going to get rid of water that's going to follow. So if we're blocking that pump, sodium doesn't go back into the blood, it stays in the nephron, and then it gets eliminated and it goes into our urine, and water is going to follow that. So that's what makes it a water pill, because we're blocking that pump, keeping sodium there, and then water follows. Now, indirectly, we also lose some potassium with this medication because when sodium, gets to that later part on the nephron, it also affects one of the kidney exchanges. And so now we've got some exchanges of sodium for potassium. And anyway, potassium ends up leaving the body as well. But that's not a huge focus for this medication because there's not a lot of potassium loss with thiazide diuretics. So they obviously produce a mild diuretic effect. We're getting rid of sodium. One thing to note about thiazides is that they also help you retain or keep calcium. So you get rid of sodium out of the blood, you get rid of water, but you get rid of potassium, but you hang on to calcium. And so you may see slightly elevated or slight increases in calcium levels. Not a huge deal because it's not a profound retention of calcium, but just know that that can happen. And actually, sometimes thiazides are used for people that have kidney stones because that means that you likely have too much calcium in the kidneys. And so now we can get some of that calcium back to the bloodstream and get it out of the kidneys to help treat those stones. So just something to know. A couple of other tidbits about thiazides is just watch out for glucose levels and watch out for uric acid, but I'll come back to that in a minute. Now, just to wrap up thiazides, we're reducing sodium, and for that reason, these help lower the blood pressure because we're getting fluid out of the blood vessels, and that's going to help with blood pressure. So that's why you see these used in conditions like high blood pressure or hypertension. And because you lose a little bit of potassium, you might have some cramps or weakness, but that's not a super common thing. And just know that these medications do have some mild diuretic or water loss effects. So you might pee a little bit more often. All right, now let's talk about the loop diuretics. Loop diuretics are medications like furosemide or torsemide. A lot of people are on furosemide. The brand name for that is Lasix. And furosemide or loop diuretics in general work on the room that is known as the thick ascending loop of Henle. And again, you'll see that on the graphic on the screen. This is really the power room. This is the main location for fluid control. Loops are going to block the sodium potassium 2 chloride pump. And normally this pump reabsorbs huge amounts of sodium and potassium and chloride. Now, why does that matter? If we block this pump with loop diuretics like furosemide, then once again, we're not reabsorbing that sodium back into the bloodstream. Massive amounts of sodium are going to stay in the nephron, which means that massive amounts of sodium are going to be lost in the urine. And what follows sodium? Water. Yes. So massive water loss, which is why these are one of our most potent or strongest acting diuretics. Again, these are our loop diuretics. Now, not only are we losing lots of sodium, but we're also losing lots of potassium and magnesium. So we have to make sure that we are monitoring those levels. And actually, oftentimes when we start people on a loop diuretic like furosemide, we will also go ahead and give you a potassium supplement because we definitely don't want the potassium balance is very finite. So we don't really want to affect that and not have you already on something to help mitigate or control that. And you already know from prior videos, potassium is something that can affect your electrical activity of the heart, if I can get my words out. And so, if our potassium goes too low, then it's going to lead to cardiac or heart issues that we don't want to deal with. We don't want you to deal with. And so, we'll go ahead and give you a little bit of a potassium supplement to go along with the furosemide. And we're really just trying to manage risk versus benefits here, because if you're someone who's using furosemide because you are fluid overloaded, whether that's showing up as ankle swelling or fluid around the lungs, we need to get that fluid off of you. Because that's going to be a high risk for you in that moment. But because we're going to be getting lots of fluid off, and with that fluid loss comes sodium and potassium and other electrolyte loss, we want to make sure that we replenish that. So we'll give you potassium, and I'll leave that piece alone. Now, um, the thing that comes with this, of course, if we're losing a lot of fluid, is that you're going to pee a lot and fast. So we usually recommend that patients take the furosemide or their loop diuretics in the morning, because once you take it, you're going to have to go to the bathroom. Like, it's just a given. So what are the big overarching things with loop diuretics? One, a lot of fluid loss, and that is because we're losing sodium, we're losing a lot of water with it, but we're also losing potassium and magnesium. But the benefits are that we're going to reduce the swelling that you have. We're going to relieve any fluid overload that you're dealing with or concerned with. And it's really going to help, especially in heart failure, if you have symptoms, and it's going to help really quickly, like within an hour or two for a lot of people. And oftentimes when people take their loop diuretic, they may see like even 2 to 3 pounds of fluid that come off within a day. Just if you're like weighing yourself in the morning before you take your fluid pill, and then weighing yourself later, shortly after you take your fluid pill, you'll see a drastic difference in that. All right. Now I'm going to talk about one final diuretic. So the third one, or one final class, which are our aldosterone antagonist, potassium-sparing diuretics. They go by a few different names, but the main two medications that we look at in this class are spironolactone and eplerenone. And these medications act or enter the room called the collecting duct. And this room is where the kidney decides whether or not it wants to save potassium or release potassium. So spironolactone blocks a substance called aldosterone, and aldosterone is normally like our one of our salt-saving hormones. It does several other things as well. So, aldosterone antagonists could have their own video, but it's one of our salt-saving hormones. Aldosterone antagonists or potassium-sparing diuretics, which are what these are used in a bunch of different conditions like heart failure. You can use them in hypertension, hyperaldosteronism, if someone has high aldosterone levels, PCOS, and other things as well, acne. So they have multiple uses. Now, if we block aldosterone or have less aldosterone, then that means that we're getting sodium out. So we're losing sodium again, which means that we're also losing water. But potassium stays in. So we don't have aldosterone there to save our or to release our potassium. So now we are saving a lot more potassium. By blocking aldosterone, we are also helping to prevent some harmful heart remodeling that can occur. So this is why spironolactone helps people with heart failure, and specifically it has been shown to prolong survival in individuals who have heart failure, specifically if your ejection fraction is less than 45 or 40. Now, in terms of overall effects on the body with spironolactone and eplerenone, they have mild diuretic effects. They increase potassium. So remember, the other diuretics that we talked about reduce your potassium levels. These are going to increase your potassium levels. And so because of that, you want to make sure that you're going back to get your labs drawn shortly after you start this medication, so that we can see within a few days, within a week, within a month, how quickly your potassium is going up. We do expect to see a bump in it. But if we see a drastic bump, then we're going to have to do something different, whether that's adjust your dose, take you off the medication, or give you something to bring that potassium down fairly quickly. These medications do help lower blood pressure, so we can use them in patients with high blood pressure. It's not usually one of the first things we go to unless we already know that your aldosterone levels may be causing your blood pressure to be high, or unless you're already on, 3 of our primary agents that we use for high blood pressure, then we might start on spironolactone. Of course, as I mentioned, if you're someone who is battling with heart failure, then spironolactone may be added on for survival benefits, and then it can be useful for hormonal things like PCOS and hormonal acne. All right. So, as you can see, we've talked through thiazide diuretics, loop diuretics, and potassium-sparing diuretics, which are also called aldosterone antagonists. And these medications don't just act differently, they work in completely different parts of the kidney or specifically different parts of the nephron. Now, I want to talk about some ADRs or contraindications, side effects. So, this is where the B comes in finally. We're on but. So if you're thinking about, what are some risks associated with these medications if you're taking one? I've already talked about, with thiazides that they're going to lower things like potassium. So with lower potassium comes muscle cramps, weakness, heart palpitations, dizziness. But just know that that loss of potassium is not that huge with thiazide diuretics. So I don't want you to be super concerned. And also know that these medications aren't going to be your main workhorse when it comes to swelling because they are not getting that much sodium off or that much potassium off. But they are helpful to get some off, which will help support your blood pressure. Also, thiazide diuretics, especially when used over a few months or longer, can sometimes cause an increase in blood glucose level. So if you have diabetes and you're on a thiazide, just watch out for that. And also, if you have gout and you're on a thiazide, watch out for increases in uric acid level. I actually um, story had a person at one point who I was talking to, a community member who kept having gouty attacks, and they kept going to the emergency room for these gouty attacks, unfortunately. And I finally just was like, let me see what other medications you're on. That's where that's my expertise level or area. So if I'm going to help you, let me start there. So I looked at his med list, and he was on chlorthalidone. And so I told him to talk to his primary care provider and see if they would be willing to either come down on his dose of chlorthalidone or switch him to something else for his blood pressure because he had some wiggle room where he could be switched to some other things. And I gave him some examples to talk to his physician about. And yeah, helped a lot. He came off the chlorthalidone. I mean, he was having gouty attacks like a couple times a month, and they were really debilitating and bothersome for him. So because the thiazides enter on the front part of the nephron, they're competing with other things that also enter the nephron, things like uric acid. And so then uric acid ends up staying in the bloodstream because the thiazide competes and wins oftentimes and does not allow uric acid to be filtered and removed from the body. So just watch out for that if you have gout. Now, loop diuretics, because they drop the potassium and magnesium a lot, um, just be careful with that. Make sure that you're getting your supplement if you're supposed to be taking one. They can also cause dehydration because we are getting rid of so much fluid. So it seems counterproductive, I guess I should say, that, we want to get fluid off the body. So why would we drink a lot? But you have to stay hydrated. So you're gonna urinate a lot, but you also need to make sure that you're consuming plenty of water if you're on any of these diuretics, but definitely if you're on a loop diuretic. And if you take too much of it, it could potentially lead to harm of the kidney. So just make sure that you're taking your dose appropriately. If you're supposed to be taking it as needed, just make sure that you're using appropriate time frames between those doses so that you're not overdosing or taking too much of it. And then finally, with our spironolactone type medications, so these are our potassium sparing diuretics. They can definitely raise the potassium, and sometimes they can raise it too high. So make sure you want to get your levels checked. But if you notice that you have an irregular heartbeat or some chest discomfort, that might be a sign that your potassium levels are a little high. So go get that checked out quickly, and make sure that you talk to your physician about that or your provider. And then they can also interact with other medications like ACE inhibitors and ARBs. Not a big deal. We have plenty of patients that are on, lisinopril and spironolactone, but just know that they're kind of working on a similar pathway. And so we just want to make sure that you're watching out for, again, the ACE and ARBs can also increase potassium a little bit and affect the kidney. And now we've got the spironolactone drugs that are doing that. So very close eye on your potassium levels. All right, and then finally, spironolactone can cause something called gynecomastia, particularly in men, where you get enlargement of the breast tissue. It's not anything dangerous, but it is something if it's uncomfortable or even if it's not, if it's just you don't like it, then talk to your provider and come off of it. We could switch you to Eplerenone, which is similar class or same class, but the chemical structure of it is slightly different, and so we don't have as much of the hormonal effects with eplerenone as we do with spironolactone. So if you're on spironolactone, noticing some abnormal breast growth, breast enlargement, then we can switch you to eplerenone, which is another potassium-sparing diuretic. And in women, you might see some menstrual changes. Again, this is used to help spironolactone specifically with things like PCOS and hormonal acne. So there is a time and a place for that. But if you're not on it for that and you're noticing menstrual changes, again, talk to your healthcare provider and see if there's something that you could be switched to. All right, let's talk about some clinical benefits of these drugs. Now, I've already talked about them a little bit as I've gone through the video, but this is why your doctor is choosing the specific water pill for you. So, thiazides are going to be best for high blood pressure. You can use them for a long time. They are very well studied. Chlorthalidone is a little bit stronger than HCTZ. So, sometimes you might notice that you're switched from HCTZ to chlorthalidone, and that's completely fine. If you're someone who's older, over the age of 65, we're usually a little more cautious with using chlorthalidone because your electrolyte balance is a little more sensitive. So just know that chlorthalidone and HCTZ do the same thing, but chlorthalidone is a little bit of a stronger version of HCTZ. And then our loop diuretics, so these are going to be best for swelling, especially from heart failure. Removes fluid around the lungs. They work pretty quickly. Even if you have swelling from something else, like if we know that it's swelling due to water and not another issue with swelling from something else, that could be hormonal, then this will help get fluid off. Specifically in heart failure, we know that these medications help prevent hospitalization. And I'm really passionate about this because my dad died from heart failure and he was on a diuretic. He was also on other medications that were, potentially life-saving in patients with heart failure. And so he ended up having fluid overload, and looking at his pill bottles later, because I wasn't a pharmacist at the time, we did notice that he probably wasn't using that water pill as often as he needed to because there were too many pills in the bottle. And so I will say, if you are having that fluid overload, make sure that you're using your water pill. It's going to help prevent hospitalizations. We know that to be true. We've seen that in all of our studies. And also it helps the heart to just pump more efficiently, to pump better, do its job better. And then finally, with spironolactone, we know that this also improves survival, helps you live longer if you're someone with heart failure. It also helps with what we call resistant hypertension. So those are individuals, as I mentioned earlier, who may already be on our top three options for high blood pressure, which is either an ACE or an ARB, a thiazide diuretic, or calcium channel blocker. Um, and I've got a video for calcium channel blocker out. Check that one out. I've also got an ACE ARB video. Check that one out as well. And then we're talking about the thiazide diuretics here. So those are the top three classes of meds for high blood pressure. But if you're already on one of those, blood pressure's still high, they may add on spironolactone. There's some other options as well, but spironolactone is an option that may be added on for resistant hypertension. And these medications can also help with hormonal conditions and balancing potassium if your potassium levels are too low. All right, we're up to the D, which is drug-drug or drug-food interactions. And they don't really have a lot of issues with them. Thiazides specifically, we really want to watch out for, really with any of these water pills. If you're also taking NSAIDs like Advil, if you're taking ibuprofen or naproxen, things like that, we want to watch out for that because that could affect your blood pressure and also affect your kidneys. Sometimes people are on multiple diuretics, as I mentioned at the beginning of this video. And so just watch out for a lot of diuresis and dehydration. If you're someone who is on spironolactone and also on other medications that can increase potassium, like ACEs or ARBs, be careful with that. And also try to avoid potassium-based salt substitutes because those types of things can sneak up on you. And then there are medications like Bactrim, which is an antibiotic that can also cause hyperkalemia. So if you're on spironolactone and also getting Bactrim for something, just be extra sensitive to what your symptoms are during that time, just so that you can report them fairly quickly. All right. So E is my extra special pearl, and I wanted you to stay to the end because I really wanted to talk about this. And specifically, this is that. And specifically, this is that medications like Lasix or Furosemide are not going to work really well if you are not controlling your sodium. So someone made a comment recently about, talking about lifestyle modifications and we talk about that. I talk about that with every person that I talk to. Dietary, physical activity, all those types of things come before all of these medications. And so when we think about things like heart failure and high blood pressure, one of the things that we often counsel on is dietary sodium. And so if you're taking Lasix, like it's not gonna, your kidneys are still gonna reabsorb water no matter how much Lasix you take. The Lasix or furosemide is just going to help mitigate that or control that. So if you're someone who is on Lasix and you're like, oh, it's not working for me, it's probably not the Lasix. Either your kidneys aren't working well or you're consuming too much salt. And if you recall, water is going to follow sodium every time. So if you're consuming a bunch of salt, your body's going to want to hold on to that water even more so than it would have because you've got so much sodium or salt in your system, in your bloodstream, that now you're going to be trying to reabsorb more. And the lakes is going to have to work harder, or they're going to have to increase your dose just to catch up with your lifestyle. So make sure that you are controlling your sodium slash salt intake, and it doesn't matter like what the salt source is. It can be Himalayan salt, pink salt, his salt, her salt, their salt. It doesn't matter. Like some of those salts are fancier and have some other mineral based benefits to them, but to the body, sodium is sodium. So it doesn't matter where or what source you're getting it from. It's salt is salt. Now, that's it. If this video helped you, please share it with someone, specifically someone who is taking a water pill. Don't forget to download your free medication mind map so you can organize all of your medications in one place. Please subscribe, like this video, and I'll see you in the next one. Thank you.